Um, Hello, hi. Good evening, everybody. I'm Dr. Pratima, endodontist, practicing with Partha Dental Skin and Hair from Kottapet. Hope you all are safe in this pandemic and stay home, stay safe. It's very important to maintain your health this in this pandemic. Um, so maintain proper social distance when you move out into public and avoid as much as possible. Okay, so today I'm going to share something important, and the first thing is we Partha branches, dental, skin, and hair are open all the days, all over the week. So you can visit any of the branch which is close to for any of the dental, skin, or hair procedures, and yeah, we follow the proper COVID protocols, which were followed by the ICMR and WHO guidelines we follow. So no doubt for getting any of the dental treatment procedures from Partha. You're safe in Partha, and all our doctors, working assistants, front desk staff, all are vaccinated. We have finished all the 2 doses of the vaccine. So we assure that our patients are safe, and we work in proper sterilization conditions also. So no worries regarding your treatment in Partha. And another important thing is we work on an appointment basis. So please contact 040 for your appointments. As maintaining appointment is also important so that the patient exposure is completely um, avoided to the others. Um, Completely avoided. Maintain proper social distance also. In the clinic also we see that our patients are made to follow social distancing. Not more than 1 or 2 patients will be waiting at the reception area or the waiting hall. This minimizes the exposure of the patients also, and the waiting hall also will be less crowded. And all the sanitization procedures are also followed, that we check the temperatures of the patient, we give hand sanitizer, and also we give gloves so that they are completely protected. And doctors and the working assistants also cover themselves with the PPE kits, so that there would be no cross contamination by the doctor to the patient or by the patient to the doctor. um, so these are the safety measures that we take. So for any of the appointments or for any of the procedures for the dental, skin, or hair, you are safe enough to visit us. I again repeat the number: call 040 4142 0000 for the appointments. And we also have a digital consultation also. And we have you can even log into the www.parthadental.com. We have live chat also with the doctors, or you can even book the appointment online. If there is a condition that you cannot visit the doctor and you have a doubt regarding your issues or the concern, you can go for a video chat, or even you can communicate digitally, or there is a WhatsApp chat available. So log into the website, and you have a clear instructions provided there, so you can easily approach us. And if you want to call, again I repeat, it's 040 4142 0000. Okay, so in this video today I'm going to talk about the recent advanced procedure that are lasers in dentistry. um, as I said, we extend Partha as a dental, skin, and hair. So it's clearly understandable that Partha has extended its services for the skin and hair treatments also. So you can visit for the cosmetological purpose also. And today, as I said, we are going to talk about the laser treatment in dental procedures. So what are the laser treatments that we provide, and how are these lasers applied? Like, what are the various procedures for the uh, lasers we provide? I'm going to talk about that. Okay, so first thing, what are lasers? Lasers are light amplification by stimulated emission of radiation. So in simple language, lasers have a certain wavelength of light through which they work. So that's what the basic idea of lasers. So I have explained the lasers according to the word. Okay, so now what are these lasers I have told? So there are two types of lasers we have available in dentistry. One is a soft tissue laser, the other is a hard tissue laser. So soft tissue laser, the name itself says that can be used for the soft tissues in the oral cavity, like soft tissues like phrenectomy, gingivectomy, opiculectomy. So these are the soft tissues we have in our mouth for the lasers. And hard tissue lasers, they act upon the bone or on the tooth, specific tooth where we have to work. So these are the two types of lasers that we have in dentistry. So what are the soft tissue lasers? So what are the applications that we have is, the first thing I said is the phrenectomy. So what's the phrenectomy? Phrenectomy is the removal of the frenum. Frenum is a soft tissue that is connecting or between lips and the gums and below the basal part of the tongue. So removal of this tissue in certain cases where the movements of the tongue are restricted, like the tongue cannot be raised up to the palate. So in that case, we remove the frenum. So this is called the phrenectomy, and these are conveniently and comfortably uh, uh, can be removed uh, comfortably and comfortable for the patient as well as the doctor also. And the second is opiculectomy, that is removal of soft tissue like gum tissue, especially in the areas of where the wisdom tooth had erupted and still small part of gingiva is covered over that, which might get infected and lead to pericoronitis, a condition called pericoronitis where the soft tissue is being infected. So in that case, the tissue covering the wisdom tooth or the tooth is called operculum. So this operculum needs to be removed. So instead of using blades as a traditional method, we have a recent advancement of lasers. So working with the lasers, yeah, definitely there would be a reduction in the time, and also the bleeding condition is also been reduced. So in the opiculectomy also we can use lasers. At the same time, in the gum diseases, like when there is a bleeding from the gums or when the gums reside and when your gums are swollen, definitely it's a condition of gingivitis. So depending upon the phase or the stage where your disease has been classified, you can use laser according to the wavelength that been um, fixed before. So removal of the inflamed or infected tissue or the gums, so that patient pain level is also reduced and also the bleeding has been reduced. So these are the main or common procedures where we use lasers. So there are other procedures also, and like as a hard tissue laser that act upon the bone. For example, in case of osteotomy procedures, where the bone architecture has to be developed in case of periodontitis condition, or in case where tooth covering the bone for the extraction can be removed with the lasers. And also for the and also on the action on the tooth, like in case of minute cavities where these cavities need to be filled with the restorative material, in that condition also we can use this hard tissue laser to make cavities on the tooth and later on filled with the restorative material. So these lasers can also be used for the bonding of the restorative material also. So using this lasers on the cavity preparation definitely would reduce the drilling action over the tooth. It reduces or it completely um, uh, facilitates for the desensitizing procedure also, because this laser acts upon abrading of the tissue. So yeah, definitely there would not be a problem of sensitivity for the tooth during this cavity preparation with lasers. And other procedures can also be like you can have for the teeth whitening procedures also. So what are this teeth whitening? When teeth, few patients or few people might not be happy with the color of the teeth they have. It might be due to yellowish stains on the tooth, or they want the teeth to be more white so that they have a beautiful smile. So in that case also, for the teeth whitening procedure, we use lasers. Yeah, but these lasers have a major advantage with this. It's a least time taken for the bleaching procedure when compared to the conventional procedures. And the second and the other a procedure where we can use lasers is in the root canals. So especially in case of single sitting root canals where there is an underlying pathology below the apex of the tooth or below the tooth, definitely in that condition we have, when we are doing a single sitting especially, we need to see that the root canals are completely disinfected so that there would be no further infection flare-ups. So in that case also, for the disinfection of the root canal, we use dental lasers. And the other condition where we use is in case of immediate loading implants. So what are immediate loading implants? Implants are immediate loading implants are like when the tooth is extracted, and if the implant has been planned to be done on the same day at the same time, the socket, the extraction socket site has to be completely disinfectant so that there would be a less chance of infections, reoccurrence of the infection at the area of the implant site. So these lasers can also helpful in disinfection of the extraction socket also. And these lasers can also be helpful in removing of calculus on the titanium surface of the implants also. In case of peri-implantitis condition, this lasers can remove the calculus or the infected gum around the implant site, which helps for the further healing of the implant site, and also reduction of the peri-implantitis condition. And the other condition where we can use is case of crown lengthening procedures. So crown lengthening procedures are like in case to have when the clinical when the crown, the tooth to be crowned or cap, the way the cap has to be fixed when the tooth is smaller, and in that condition also lasers can be used. And these can be lasers can be used, and these can be crown lengthening procedures. Most of the procedures and crown lengthening procedures, so in that condition also crown lengthening can be done so that the crowns can have a proper retention. And in case of gummy smiles also, these lasers are helpful for the reduction of the uh, gum length. So in these conditions we have lasers, we can use lasers. So these are all the situations, and there are, yeah, definitely more procedures are being can be involved depending upon the condition. And yeah, these lasers, so why are these lasers important? What happens when the use of these lasers is, the first, these lasers are more efficient than compared to the conventional procedures. The second, they definitely take less time, and appointment process chairside time is also less, and the working time that can be and the working time is also less. And the third condition and the third benefit is patient is comfortable, because these are painless when compared to the conventional treatments. Also, the procedure is then the procedure there is less bleeding during the procedure and more comfortable for the patient. And yeah, with all these benefits, lasers are much more advanced, and lasers can be much more used for many dental procedures. And we are happy to say that we in Partha, only the trained doctors or only the specialists can are preferred to be use lasers on the treatments on the patients, so that patients are completely assured and safe. And we see that the treatment is being followed very good in this pandemic, much better than before, with all the COVID protocols. And you can call to 040 4142 0000 for any of your concerns or issues regarding skin, hair, or dental issues. And remember, healthy mouth makes a healthy body. So please see that your oral cavity is maintained properly. And this pandemic is a good time to maintain good oral hygiene. And in case of any dental issues, this is a good time to visit your nearest dental branch, so that we can provide much more better treatment, as we follow single appointment procedure, where you multiple concerns of you can be treated in a single appointment, so that your multiple visits can be reduced, and we work much more efficient in this pandemic. So no doubt, if you have to visit for your concern, you're safe enough in Partha Dentals. And we have these branches in Telangana, Andhra Pradesh, Bangalore. So there are totally 126 plus branches. And if any of the treatment in case is costing you than expected, we even provide finance option also. So the finance option can be with the Bajaj Finance or Money Tap, so that your treatment can be started initially, and you can have a EMI options with the company of Money Tap or Bajaj Finance. So for any other doubts or for any other concerns, you can visit. And stay safe, stay strong, and maintain proper social distance when you visit out. But see that you are going or you are visiting outside environment is should be less. And keep the safety of the family in mind. Be safety, follow the double masking technique, cover your face with a shield. And once you return home, immediately wash your masks if they are washable, and sanitize your facial screen, and immediately have a bath, so that sanitize your whole body. And then you can expose to the other family members. So and the same in Pardo also, your safety is your priority, and definitely we work for that. So that's it for today. And please focus on the black fungus, uh, the very common side effect that we are seeing in this COVID positive patients. So take care of that. Black fungus can be treated by dentists, ENT, and ophthalmologist. So we definitely treat black fungus cases also in our branches. So, if any doubts, the symptoms like if you have a mobile teeth or a foul odor from your mouth, which was not before, and if you have multiple pus discharges or foul odor in your mouth or pus discharge near the tooth, in the multiple sides, and if you have a blackish discharge from the nasal cavity, and you have a nose blockage, or you have pain in the eyes and if difficulty in the closing of the eyes, all this could be a symptoms of a black fungus. So please be careful. Observe yourself, observe your family members, especially in those who are COVID positive, because their immunity has been suppressed by the many medications that been used. So take care, and if any of these signs or symptoms you notice, definitely visit or immediately visit, or have a video call or a digital consultation with the doctor, and we follow the treatment as per the WHO organization. And initial treatment is much better than the treatment which you have when it is more diseased. So kindly take care of that. And that's it for today. Stay safe. Thank you.